Well, good afternoon, everyone. My name is Nick Mullins, and welcome to Activ Doctors Online May webinar. If you didn't know, May is Arthritis Awareness Month, so we thought what better topic for our webinar this month than arthritis. In today's webinar, we're going to be looking at what exactly is arthritis, so some common types of arthritis, different forms of arthritis, their signs, their symptoms, and what you can do to manage arthritis. As always, we have our resident expert, Dr. Howard Zahalsky, who's been our medical director since 2010, and as you can see, has had quite the medical career. So with that, I'd like to welcome Dr. Zahalsky. Thank you for joining us, and I'll pass it over to you.
Thank you, Nick. So I'm happy today to be able to talk to you about arthritis for Arthritis Awareness Month. Before we get started talking about arthritis, we have to actually go through some definitions. It's back to elementary school class. The first thing that we have to define is a joint. Most people would think they know exactly what a joint is, but it's actually not as straightforward as you think. A joint is anywhere that two bones meet. So there are the joints that are very obvious to you, such as the elbow and the knee. There where two bones come together or three bones come together and move. But there are several other areas that you have joints in your body that you may not even think about. For instance, your spine. In your spine, it is made up of a pile of flattish bones called vertebrae that all meet in a couple of areas over the course of your spine. So when you get back pain, sometimes that can be caused by arthritis of your spine. In addition, there are some joints that don't move nearly as much as your knees or even your spine, which moves every time you bend your back. For instance, your ribs, where your ribs meet your breastbone or sternum, every time you take a deep breath, the ribs and your sternum move slightly against each other, and you can actually get arthritis at the point where your ribs meet your sternum. So anywhere you have two bones or more bones that meet, that is a joint as far as arthritis and this talk is going to be concerned. The next definition that we have to understand is actually the term arthritis. Arthritis can be a lot of different things, but for the purpose of this talk, we're going to talk about arthritis as inflammation of the joints. That is the typical definition that doctors use, is when joints are inflamed, you have arthritis. That is actually very, very different than pain in the joints. Pain in the joints is known to doctors as arthralgia. So there are some things that are known to be arthritis that are actually more of arthralgia, and we will talk about those throughout the talk as well. So now that we understand what arthritis is, hopefully, and what all of our joints in our body are, we're going to go on to the next slide and understand the anatomy of the joint, which can help us to understand how and why arthritis happens. So this is a picture of the joint. I'm going to try and keep it as simple as possible. Hopefully from this drawing you can see that there is a lower bone, which kind of has a cup-like appearance, and an upper bone which has a more rounded appearance, and they're meeting at this joint. Over on the left, the third or fourth written name down, you'll see that they're pointing to these two blue areas called articular cartilage. Articular cartilage are padding at the ends of the bones, usually found at joints, usually found where the bones meet, that are essentially padding for the joints. This is so that when the bones rub against each other, they're not actually rubbing bone on bone, but rather cartilage on cartilage to soften the movement and to make it so that the joints don't hurt. Also, in between those blue lines of articular cartilage is a red area. That's not blood. That's actually fluid. It's actually clear fluid if you were to drain it off most people, and it's known as synovial fluid. It's a fluid that washes over the cartilage to keep it nice and moist, so that even though the cartilage may rub against each other, it's staying nice and smooth and calm and not irritated and pain-free. So The bones themselves can be very sensitive. As you know, if you've ever broken a bone, any injury or damage or even bruise to a bone can be very uncomfortable. But the cartilage lining and the fluid that washes over the cartilage keeps the bones from touching each other and keeps the joints nice and calm and able to be used. Let's go on to the next slide. So here I have a picture of a pencil with an eraser. This is just so I can continue my analogy. The eraser on the end of the pencil is actually like the articular cartilage in your joint. It's padding. So if you have an eraser and you're trying to erase something that you just wrote, you're going to rub the eraser against the paper. It's going to move fairly smoothly. It's not going to scratch the paper. It's not going to break the pencil. You're not going to tear the paper that the writing is on. However, over time, when you use that eraser over and over and over again, you get the next slide. Here you have a worn down eraser. Just like a tire, an eraser, the cartilage in your joint can get worn down over time. This isn't because you've necessarily done anything wrong to the joints at all. It just means that you've worn them down. And this can happen merely because of age, when you get to your 50s, 60s, 70s, or 80s in some people. It can be because you were mean to your joints over the years. Maybe you were a professional football player and you did a lot more banging of your joints. Maybe you're a marathon runner and those knees have gotten worn out from miles and miles of pavement running. Maybe you're overweight and those joints have had to support extra weight. And maybe you're just unlucky and your joints have worn out a little faster than the average person. Over time, those joints are going to get worn down, and we know this as osteoarthritis. Let's go on to the next slide here. So this is a picture of osteoarthritis, particularly in the knee joint. The knee is one of the joints that is most susceptible to osteoarthritis. On the left, you have the tan bones, and the silver, blue, whitish area is that articular cartilage that is keeping the joint smooth. On the right picture, you have a joint with osteoarthritis, where the cartilage has gotten worn down like that pencil eraser, and as a result, the bone has started rubbing directly against the bone. Well, bone is alive. Bone grows. That's why your bones heal up after you break them. And the bone does not like to get rubbed, and it doesn't like to get worn down. So you may notice that the bone on the right has taken on a lumpy appearance. We call those bone spurs, where because of rubbing directly on the bone has tried to heal itself and formed little bumps and lumps, which actually cause the bone to rub even more and make the problems worse. Now, one thing to notice about this is, despite my initial definitions, this is not an inflammatory process. This is not the bone or the cartilage getting irritated. This is merely a direct consequence of it getting worn down. So although we call this osteoarthritis, it is more of osteoarthralgia. The bones become painful because of overuse, and there's actually minimal to no arthritis or inflammation involved most of the time. There are certain circumstances where the bone and the joints can get inflamed, but most of the time people with osteoarthritis just have wear and tear without actual inflammation. So the joints will be worn down, they will hurt, but they will usually not be inflamed. Now, before we leave this slide, I want to make an important distinction. A lot of people confuse osteoarthritis and osteoporosis. They're both problems with the bone, and the prefix osteo actually means bone, but they are two very different things. Osteoarthritis is, as we've discussed, this wearing down of the cartilage and subsequently the bone underneath. Osteoporosis just means thinning of the bone, and it can make you more susceptible to breaking your bones and is more common in elderly women. However, osteoarthritis and osteoporosis are two completely independent conditions. Having osteoarthritis doesn't make your bones any thinner. In fact, those bumps and lumps that build up can actually thicken the bone. And having osteoporosis or thin bones doesn't make you any more susceptible to wearing down your bones, although it does make you more likely to fracture your bones if, for instance, you fall. Now on the next slide, we'll get to kind of the meat and potatoes of arthritis. This picture is rheumatoid arthritis, but it actually can describe almost any kind of inflammatory arthritis. What is inflammatory arthritis, and in particular rheumatoid arthritis? These are conditions most commonly where your body attacks your own joints for some reason. Your body detects either a problem in the joint or an invasion into the joint, and as a result, your body attacks the joint as it would, for instance, an infection. When you get a sinus infection, your body sends inflammatory cells to fight the infection. Your sinuses will get red, they'll get swollen, you'll feel pressure in your sinuses, you may get a headache or facial pain, you get dripping down the back of your throat and coughing. Now imagine that happens in, for instance, again, your knee, because this is again a picture of the knee. What happens is your body attacks your joint, not because of you have a cold per se, but because of many other reasons that I'll get to in a second. The knee will get red, it will get warm, it will get swollen, and the swelling and the inflammatory response is going to wear down the cartilage and subsequently wear down the bone. So let's talk briefly about the different types of inflammatory arthritis. The main type of inflammatory arthritis that you hear the most about is rheumatoid arthritis. In rheumatoid arthritis, for reasons that we don't fully understand, your body confuses your joints with bacteria. Some bacteria have proteins on them that look very similar to some of the proteins found in your knee. Your body is made up of proteins. So your immune system can confuse your knee, and in particular your knuckles, with bacteria and attack them and literally try to kill them. This causes all sorts of infection-fighting cells to descend on the knee, and it looks like your knee is infected. These cells, in an attempt to kill the bacteria, spray the area with chemicals that are designed to destroy bacteria, and they are toxic to your joints as well. They cause extra fluid to build up in your knee. You can see in this picture on the right side, they can cause bone loss and bone erosion. The fluid in your knee will get larger, which makes your knee less mobile, and over time can do real damage to whatever joint they are affecting. Now, rheumatoid arthritis, where your body mistakes your joints for bacteria, is not the only type of inflammatory arthritis out there. There are several other types of inflammatory arthritis. They have names like psoriatic arthritis, where your body, in addition to attacking its own joints, can attack its own skin, leaving you with these silvery, scaly patches all over your skin. There are other autoimmune diseases that affect the joints, including one called lupus. There's also something called Reiter's syndrome, where your body attacks both your urethra and oftentimes your knee. Your urethra is the tube that you pee through. Different types of arthritis definitely affect different parts of the body when it comes to inflammatory arthritis. For instance, as I said, rheumatoid arthritis favors the knuckles and sometimes the knees. Psoriatic arthritis favors the big joints, again, the shoulders, the hips, and Reiter's disease, as I said, is primarily a knee problem. In addition to actually attacking the joints, the fluid that builds up in the joints contains a lot of these inflammatory cells, these cells that are designed to attack, and because of that, it's that fluid that does much of the damage. Sometimes these conditions will be treated in part by draining some of the fluid out of the joints and hoping that that settles down the joints. So on the next slide, we'll see what inflammatory arthritis looks like. You can clearly tell that this person has their left knee, and I say left knee because we're looking at the person. It's on the right side of the screen, but since we're looking at the person head on, it's their left knee, causes redness, warmth, and swelling, in addition to the pain. In fact, the pain is not what the arthritis is, as we learned earlier. The pain is the arthralgia, the redness, the warmth, the swelling. That's the inflammation. That's what makes this arthritis and not just arthralgia. Now, there's one more type of arthritis which doesn't really fall into either of the categories that I listed, but is still an inflammatory arthritis, and that's gout. And we're going to see gout on the next slide. So gout is another inflammatory arthritis that usually affects the base of the big toe. Anytime someone comes into my office with pain in that location, I can tell before I even do any of the further testing that that's almost certain to be gout. In most of the inflammatory arthritis conditions, your body actually attacks itself for some reason. It confuses you for bacteria or some other invader that your body is trying to destroy. In wear and tear arthritis, the osteoarthritis, the joint just gets worn out. In gout, your body is actually attacking its own joint, but believe it or not, for kind of a good reason. In gout, your body produces too much uric acid. Uric acid is a crystal that is a byproduct of the digestion of proteins. Let me explain that in a slightly better way. Every time you eat protein, one of the things your body does with it is build muscle. Muscles are the main proteins in your body. But muscles don't last forever. No part of your body lasts forever. And over time, as you use your muscles, some of your muscles get broken down. For instance, when you're weightlifting or even going for a walk. And your body breaks down those muscles, cleans them up, and builds new muscles. The muscles that are used up, so to speak, get broken down by your body naturally. It's a very normal, healthy process. And the chemicals from the proteins usually get eliminated into your urine. However, in gout, your body does not dissolve your worn out muscles properly. And instead of the byproducts of the muscles just getting peed out in the urine, what happens is those crystals build up. And they like to fall by gravity, because imagine if you put crystals into a cup of water, they would fall to the bottom. So they fall by gravity to the lowest point in your body, which is the base of the big toe. Your body does not like having crystals in its big toe. In fact, the crystals themselves can do a fair amount of damage to your joint. So what your body does is it attacks the crystals to destroy them. Well, sometimes the cure is worse than the disease, because the attack on the crystals actually does more damage to the joint than the crystals would have by themselves. And when that happens, the joint gets big and red and swollen, and we call this gout. Let's go on to the next slide. So how do we treat arthritis? Well, clearly there are multiple different types of arthritis, and each one requires its own treatment in order to effectively control the condition. For osteoarthritis, or wear and tear arthritis, once something gets worn out, there's just no way around it. The only way to fix it is to repair it structurally, and usually for osteoarthritis, that means joint replacement. Here you have a picture that shows what a typical, for instance, knee joint replacement would entail. They take off the bony ends and replace them with either metal or ceramic replacements. Now, these don't last forever. Your body is made very, very well. And while a joint that you are born with might last between 50 and 80 years, one of our artificial joints, they usually only last 10 to 15 years, even the best ones. So we try and push off joint replacement as long as possible, because doing one joint replacement is not that hard for an orthopedic surgeon, but doing a second one is really, really tricky, because replacing one of these replaced joints once it wears out requires a lot more effort. So if you develop arthritis, wear and tear arthritis in your knee when you're 50, the doctor's not going to want to replace it, because they know they're going to have to go in and do it again when you're 65, and that's going to be a disaster. So if you get a condition where you need a joint replacement when you're about 50, let's say, the doctor is going to try and give you pain medicine and push off the actual replacement of the joint until you get to be 60 or so, to hopefully minimize the need to do a second joint replacement later. When I talk about pain medication rather than joint replacement, the most common painkillers that we use for arthritis, especially osteoarthritis, are what's known as NSAIDs, N-S-A-I-D-S, which stand for non-steroidal anti-inflammatory drugs. The most common drugs in this class are naproxen, which is also known as Aleve, ibuprofen, which is also known as Advil or Motrin, and diclofenac, which is also known as Voltaren. There's about 50 others, and they are all in this non-steroidal anti-inflammatory drug class. I bet a lot of you have heard of medicines in this class and have heard that, wow, if I get an irritated joint, I should take them because they're going to reduce the inflammation. They actually don't do anything for inflammation. That's why they're good for osteoarthritis, which has no inflammation. What they do is they block certain pain chemicals that are, in fact, associated with inflammation. So, for instance, they work better than Tylenol, which Tylenol, for instance, just goes to the brain and tells you not to feel pain that exists. They actually work with inflammation to block the inflammatory chemicals that cause pain, but they don't actually block inflammation themselves. They don't make the redness any better. They don't make the swelling any better. And if your doctor has told you that they do, they're lying to you. All they do is they block the pain associated with the inflammation, and they will not actually make, for instance, inflammatory arthritis any quote-unquote better. They will just make it less painful. But these medicines, NSAIDs, can be very useful for osteoarthritis and rheumatoid arthritis, just in terms of controlling pain. But what do we do to actually treat inflammatory arthritis? Unlike wear and tear arthritis, which is just going to be caused over time, these are diseases caused by very specific problems in your body attacking itself for some reason. And is there something we could do to prevent them from damaging the joint to the point where you need a joint replacement? And on the next slide, we'll find out. There is a group of medicines called DMARDs. DMARDs stand for disease-modifying anti-rheumatic drugs. These are medications that prevent your body from attacking itself. These are some of the things that DMARDs do. They have anti-inflammatory mediators and a bunch of chemical issues that we don't need to go into that much depth in a lecture like this. But what they do is they actually stop the immune inflammatory response in your body and will prevent your body from actually destroying its own joints to the point that you might need a joint replacement. Now, these are not drugs without side effects by any means. They are very, very effective in controlling rheumatoid arthritis, psoriatic arthritis, Reiter's disease, like we were talking about. However, they decrease the functioning of your immune system. They do make you more susceptible to certain infections. For instance, you need to be checked for tuberculosis before starting on these medications, because if you have chronic tuberculosis, it can flare up when you take these medications. There are other chronic infections that can get worse when you start these, and you can be more susceptible to acute infections such as pneumonia or even the common cold while taking these medications. The second thing is because they are suppressing your immune system, they can, in some cases, cause problems with your immune system, chronic problems, such as there have even been a couple of them that have been associated with a small increased incidence of leukemia. So these are medicines that we have to use very carefully, only when necessary, and do a lot of monitoring of the patients who take them to make sure that they don't have any side effects on the medication. Some of the medications in this class that have been advertised a lot on TV, because, for instance, Phil Mickelson, the famous golfer, is known to have psoriatic arthritis and is advertising for one of these medicines. But the most common ones used right now are known as methotrexate and Humira. Now, I want to say one last thing about inflammatory arthritis. Remember, there's that outlier inflammatory arthritis, which is gout, where your body is attacking your joints, but for a reason, to destroy the crystals. For gout, suppressing the immune response is really not the best way to go. For gout, the best thing to do is to try and eliminate the crystals. And there are some medications which have names like allopurinol or Colchris, which actually are designed to reduce the amount of protein crystals in your body, oftentimes through their work on the kidneys and making the kidneys continue to eliminate the crystals that enable your body to stop having the high uric acid levels, to stop producing the crystals, which will cause the immune response, the inflammation of the joint, to go away in a more quote-unquote natural way. All right, let's go on to the next slide. So that's the basic information that you should know about arthritis. How can Activ Doctors Online's PHR work for you in order to help you with arthritis? Well, with your personal health record, you can keep track of all of your medicine, especially if you're on some of the more serious medicines, such as the DMARDs, so that if you have a different kind of medical problem, let's say you come down with an infection and end up in the emergency room, your doctors will have quick access to all of your medical information and be able to say, oh, look, here's someone who's on a DMARD. We have to take maybe any evidence of infection more seriously. Through our online second medical opinions, if you do have a serious medical problem, such as rheumatoid arthritis, and are looking for a second opinion by one of our thousands of experts throughout the medical fields, we could put you and your records in touch with a expert, for instance, a rheumatologist for rheumatoid arthritis, that might be able to give you a quick, within 48 hours, second opinion to let you know either your treatment appears to be progressing along the right course, or here's something that maybe you could consider doing differently with your doctor. Finally, if your doctor participates in our e-consultation program, you can have a video conference with your doctor, which will allow you to maybe contact your doctor more quickly and show them if your arthritis appears to be acting up or flaring, or there is some acute problem that maybe you should jump on to make sure that it gets addressed properly. With that, I'm going to turn it back over to Nick to tell you a little bit more about Activ Doctors Online's vision.
Thanks, Dr. Zahalsky. That was a great presentation, so thank you for that. I'm sure everyone's learned a lot from that. So at Activ Doctors Online, our vision is to educate, engage, and empower our members to take control of their health destiny, to save time, money, and even lives. So we hope you've enjoyed today's presentation. I know I did. And we invite you to start your free 30-day trial. You can do this by heading on over to activdoctorsonline.com and clicking the Get Started button, which you can see on your screen now. If you want to find out a bit more about our platform and what we do, or to schedule a demo, you're more than welcome to contact myself or Dr. Zahalsky with the details you can see on the screen now. And of course, don't forget to follow us and like us on all the social media channels. It's a great way to reach out to us, ask us questions, and submit your ideas for a future webinar or anything like that. So with that, thank you for tuning in, and we'll see you next month.